Elon Musk or a Doge or President Trump or whoever on the front of it, just like the kind of the one I just put up there and says, hey, millions of people are going to be audited this year from Social Security Administration. So I just want to set the record straight. A lot of people have been contacting me and said, Ed, what's going on with this? I see this in other places. So I kind of had to put up a similar thumbnail. I apologize. But I just want to reassure people this is not Doge. There's a lot of chaos out there. There's a lot of misinformation. So I'm going to take a very few minutes to kind of dispel you of this kind of internet myth out there so you can go on with your life. And then I'll go ahead and answer some questions. I'll keep it open for about 20 minutes and answer any questions you all have about anything, Social Security, retirement, disability, or anything. So what it is, I know for a fact that these are basically just what's called RZs, redeterminations, limited issues. And if you are not receiving Social Security SSI, SSI is Supplemental Security Income. It's the welfare-based program the Social Security Administration administers. And every year they come up with numbers, a quota for the entire, it's not necessarily a quota. Congress allocates a certain budget for this particular workload. And it's actually very, very good because like every dollar they put out, they get a $10 return on investment because people are receiving SSI, again, welfare-based benefits, supplemental security income, low income, low resources, and every now and then, every 6 months or every year or so, those people have to contact Social Security or Social Security contacts them and say, hey, you're receiving SSI. It's a welfare-based program. We want to make sure you didn't win the mega the mega lottery or get an inheritance or get an insurance claim or something like that or move. You might be overpaid. You might be underpaid. So this happens every single year. And there are some people out there that says, hey, there's millions of people and there's an emergency message. And this is emergency message. It comes out every single year, twice a year when they update the numbers. So let me give you an idea. So if you're on SSI, those people on SSI know the whole rigmarole. They know the situation. If you're not, then you have nothing to worry about. If you're on SSDI, Social Security Disability Insurance, and SSDI only, no issues whatsoever, not relevant to you. If you're on retirement benefits, not relevant to you. If you're on survivor benefits, not relevant to you. If you're on spouse benefits, not relevant to you. If you're on Medicare, it's not relevant to you. Okay. All right. So go live your life. If that's all you need, then have a great night. But if you got any questions, make sure you stick around. All right. So the 2 point whatever million in 2019, Social Security did 2.67 million of these. In 2020, because of the whole pandemic, they did a little bit less. 2023, they did 2.5 million, and this year it's about 2.6 million. So this happens every single year. It's been happening for years and years and years and years. It's part of the integrity workload that Social Security is in charge of to say, Congress says, hey, we're giving out this much money in welfare type benefits. And we just want to make sure the people that are receiving them are actually entitled to those benefits, actually need those benefits. They didn't, move in with someone, get married to a millionaire. They no longer need the money. So that's all that is. So when you see all the clickbait and the internet stuff, and yes, my thumbnail was a little bit clickbaity because I just wanted to reach out to those same people that saw the exact same kind of thumbnail on other social media. I wanted them to come here and just kind of, put at ease that they don't have to worry about it. And if you're on SSI and you actually get one of these limited issues or these RZs, redeterminations, kind of the same, for you, it's probably the same thing. Just make sure you reach out to them. And if you get that letter, it's very important that you complete that, because if Social Security reaches out to you and sets you an appointment for one of these redeterminations, it's extremely important that you keep it, because if you don't keep the appointment and go over all your financial stuff, income, resources, then they will stop your SSI. But again, for everybody else, retirement, regular disability benefits, spouse benefits, no issues whatsoever. Okay, so I don't waste those people's time. I apologize for that. But let's answer some actual questions on some other people here. Let me see. Kenneth Received Backpay from my WEP GPO repeal. New monthly payment total next month. Will my Part B payment go up due to the raise in benefits? No, it will not. Kenneth Matsutani, no, it will not go up unless you are making, over 2 years ago, you made over, if you're married, over 212,000. If you're single, over 106,000, then you have that IRMA, the income related monthly adjustment amount. But based on the WEP GPO, then no. And speaking of clickbait, I did a video about this, is that there's millions of people going to get these extra benefits. And then a lot of people in my comments said, oh, it's clickbait. This is all BS. No, we're not getting it. So I said, well, if you watch the video, you will know that, yes, unfortunately, it doesn't go to you. It goes to that 3% of people that, like Kenneth, worked in a non-covered entity. That is a place that did not pay Social Security, but they did work some other place that did pay Social Security. I think everybody should get the increase, but I lost that battle. So 3% of people will be getting a higher percentage than everybody else. And I, for one, think that's not fair in terms of the Social Security Fairness Act, but I lost that battle. So there it is. I received a letter for Social Security that my benefits were going to be discontinued because I had another account. 10 years ago, I applied for my late husband's Social Security. I was told did not qualify to receive. Discontinued because I had another account. So not sure. So if you were receiving benefits from another person, a surviving spouse benefits or something like that, and then you file and your benefit amount, they say basically, oh yeah, you're eligible for that benefit because you're receiving a higher benefit over here, you're not entitled to it. So that's probably it, that you're already receiving a higher benefit on another account. So usually they do what's called a simultaneous dual entitlement, where they give you one and then give you part of the actual to offset it. But in your case, for whatever reason, they decide not. But if they decided not to, if you disagree with that, just like anything with Social Security, if you say, well, no, actually, I'm not receiving any money, or whatever the case may be, yeah, make sure you file an appeal. The SSA 561, pretty easy form to fill out, takes you 5 or 10 minutes. Just fill out that form and return it, and says, no, I should get this money, or whatever the case may be. So a person asked a question much earlier. You skipped the question. If you already pay into Social Security, why do you have to pay for getting your benefits? Barbara, pay for getting your benefits. Are you talking about paying taxes on your Social Security benefits? I agree. I disagree with you as well, in the sense of, I don't think people should have to pay taxes on what they receive from Social Security. Half of the people receiving Social Security, if it basically all they're receiving is Social Security, they don't pay taxes on their Social Security. But as of the early 1980s, if you have other income, then you will pay taxes on your Social Security. Either 50% or 85% of your Social Security benefits will be taxable. You won't get a 50% tax rate or 85% tax rate. It just says 85% of your Social Security benefit is taxable at whatever tax rate you have. And the President Trump said he is going to end taxes on Social Security, which is fine. Again, I personally, and a lot of people that watch my channel on a regular basis, believe they never should have taxed Social Security, but they did, and they do, and it brings in about $50 billion a year to Social Security. So if they end taxes on Social Security, it's not going to help the 50% that, the lower income people that already don't pay taxes on Social Security. It's actually going to hurt them the worst. So because the Social Security Trust Fund is going to be depleted sooner, people are going to get cuts sooner, and they're going to be deeper. So it's always interesting when I get people that, don't even pay taxes. Say, I can't wait till they stop paying, stop paying taxes on Social Security benefits. I'm like, well, you don't pay taxes on your Social Security benefits, and this is going to hurt you worse. And like, oh crap, well, maybe I shouldn't support that. So I have a phone appointment with Social Security for my retirement benefits. I already have Medicare. Appointment was given to me nearly 2 months ago. Do you think I will have to go to the office also? Yeah, I think so. As of March 31st, the whole new identity thing, if you're doing a phone appointment, and normally in your situation, I'd say, yeah, it's easy. Yours is easy because you've already filed for Medicare. You've already, proven your ID. You're already in what we call the claims path. You're already set up to start your money benefits after you started money. After you started Medicare is super, super easy. That was a week ago. But now you have to go through the whole identity thing. So yes, it sounds as though this is it's chaos. It changes on a regular basis. So I'm not sure whether they're going to grandfather you in and say, well, since you've already got it, you already had an appointment or, whatever. But you just might have to go down to the local office and show them your ID to start your money benefits. Yes. If your local office is still open and they have employees to help you out. So let's see. Bob, I don't think they should get rid of Social Security. Yeah, you and me both, and 73 million other Americans. They should find ways to write in some type of investing in it so everyone will want it. Yeah, that's what they're trying to do, is give it over to Wall Street, at least privatize it partly, fully, or whatever the case may be, which most of the people that watch this channel disagree with. They definitely have to shore it up. And one of the things they do is, raise the cap. So everybody pays Social Security FICA tax like the rest of us. But if you make over $176,100, you're exempt. You no longer have to pay FICA tax on any money you make after that amount. So go figure. My son is applying for SSDI soon and has an attorney. He's not taking any chances with all this crazy stuff going on. Yeah, attorney. Yep, absolutely. So I've done a few videos on, filing for disability benefits. The first stage, the initial stage, the reconsideration stage. You can get an attorney if you want to. But, if you win, you have to pay them 25% back pay or not up to $9,200. And it's super, super easy to file the first two stages. The third stage, that's when I really recommend you do use an attorney. But if you want to use an attorney from the get-go, more power to you. Let's see. I called the office today to find out where I was out with my WEP, which that they told me I fell under when I signed up. She told me I was flagged for GPO. Why would that be? Oh, okay. So yeah, WEP, GPO, it's different. WEP, windfall elimination provision, is when you're receiving benefits on your own record. And a GPO, government pension offset, is when your non-covered pension offsets what you receive from a spouse. So I guess you filed a spouse claim. So there's that. Are taxes taken out before you receive Social Security? No. Are taken out after, when taxes are done with other income? No. Social Security doesn't automatically take out taxes. You can voluntarily, it's a form called a W-4V. You can voluntarily have taxes taken out ahead of the game if you want. And they just changed it a while ago that you can actually call the 800 number and do it over the phone as well. Not sure if they're going to change that, but they don't take out taxes automatically. No. Is it true that Social Security office start verifying our Social Security number as of March 31st to walk in? Well, they've always verified your Social Security number and identity and all this kind of stuff. But yeah, starting March 31st, if you are not able to file 100% online, then you will have to go down to the local Social Security office to prove your identity. And yeah, it's a solution for a problem that didn't really exist, but I would argue it's another, a lot of vulnerable people out there, elderly, disabled, are not able to do that. And it's another way to stop people from getting their benefits. And people argue back and they say, well, it's just confirming your identity. Yeah, there was no real fraud in that particular type of thing. People, I mean, very, 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 very small. There's fraud in other places of Social Security they should really focus on, but not there. Not sure. Anyway, I'm on SSDI. I have 2 children, 1 and 3 years old. They are not on my benefits. What should I do to add my benefits? Call immediately. Yeah, they should have. Yeah, someone dropped the ball there. If hopefully you were just approved for SSDI, but if you've been on it for a while, then you might be missing some benefits. Get away from your computer right now. Call Social Security immediately, 1-800-772-1213, and schedule an appointment to take auxiliary child claim. So if the children are, living with you, or if they're living with someone else, have them, whoever's going to be what's called the representative payee, ultimately responsible for the money goes for their welfare, whoever that is, have them call the 800 number and schedule an appointment immediately. Yeah, you should already be walking to the phone right now and get those benefits. They're entitled to those benefits, and they will get up to 50% of your full benefit amount. So SSDI judge approved SSA 1560 December 20th. A Social Security default withheld 25% of 8 years of back pay or 10-year favorable decision. Western Payment Center dragging the feet, told it's expedited, calling Social Security weekly, not helping. Well, I get it. Yeah, if you're entitled to it, you'll get it. Western Payment Center might not be in existence anymore. They shut down a bunch of the regional centers. And so, yeah, so the person that was working on your case, might be working at Walmart right now or something. Anyway, so yeah, contact your congressperson and say, hey, what are you doing to, what are you not doing? What are you doing to improve customer service? Because Social Security can't do this. They are given, like every federal agency, they are given resources by Congress. Money to get computers, to update computers, employees, staff to help you. And if Congress doesn't give it to them, then Social Security can't do it. It's like Starbucks. If you got 1,000 people in line, you only got one person making coffee. Guess what? Someone needs to talk to management, and management for Social Security is Congress. Well, now they're Doge, but anyway, my parents do not have a computer or know how to use one. What if they have to go verify in person? They will be 78 years old. Yeah, that's it. I mean, again, this was, there are other places that are, that have fraud in them. People receiving disability, what I just talked about, SSI, supplemental security income. That's where they should have focused it to save money. But yeah, this is just another barrier to prevent people from getting their benefits. And people like your parents are going to suffer because, so grab your laptop and go over there and set them up with a My Social Security account. And if they're not able to do it for whatever reason, then unfortunately, yeah, they're going to have to go down there. But they don't have to go down there if they're already receiving benefits and there's no issues, then they're good. Don't even, don't worry about it. The only, probably in their particular case, the only thing that if they want to change their direct deposit, then they're going to have to go online or visit a local office. But it sounds like, no issue there on yours. I would like to know, where is Congress doing all this? Yes, I agreed. I mean, I talk about the terrible, terrible things that are happening now to gut the agency. But this is not new. This has been happening, during the Biden administration, during the previous Trump administration, during Clinton, during Obama. All the Congress people, senators, and House representatives for the past few decades have not stepped up and done what they need to do to save Social Security and make sure it's, that we don't get those cuts in a few years. So verification, a good idea. You already get verified. Yeah. When you call on the phone, if you want to do a phone appointment, they ask you tons of questions. And if you don't know those questions, then yeah, you're not getting benefits. So yeah, it's a waste of time. Can a person under 58 years old who's collecting SSDI also get divorced spouse benefits if her ex is under 58 years old and still working full-time job? If so, how? No. If you're receiving SSDI, the soonest you can get divorced spouse benefits, if you were married to that person for 10 years or longer, is 62. You have to be 62 and they have to be 62. And that's the soonest you can start. Let's see. Do go to your congressperson's webpage, look for contact, write the email that helped me. Yes, there you go. Every politician, senator, House representative has on their website, has a thing on there that says, I need help with a federal agency. Click that if you need help with a federal agency, Social Security included, and say, hey, I've been waiting X amount of months for my retirement check, disability check, survivor claims. What the heck are you doing to support the local office? Forget about all the other 1,210 offices in the country. What about the office right down the street from your office, Senator? How come there's a 4-hour wait for on the phone? Why do we have to, so all politics are local, right? If you are drawing Social Security, do you need to check in? No. If you're regular to retirement benefits, survivor benefits, spouse benefits, and there's no changes or anything like that, no, you don't need to go in and check in or anything. I think, yeah, it's going to be crazy. Anytime a policy like this passes, April 1st, when this whole thing takes effect, I think it's going to be chaos at Social Security offices throughout the country because everybody thinks that they need to go down the Social Security to keep their checks going. And so please reach out to people and say, no, there is no audits, millions of people being audited by Doge and Elon Musk. That's a fake story. These are just regular redeterminations that have been done every single year for decades. If you're currently receiving benefits, you don't have to go in and check your ID to keep your check going. Please, please reach out to everybody you know and tell them that. So, or share and subscribe and like and all that other happy horseshit. What should someone that on tube stuff formula goes to doctor? Often I'm 27 on Medicare Advantage. Oh, you have tubes and stuff. Wow, 27 years old. If you're on a Medicare Advantage right now, you can, if you're on a Medicare Advantage plan right now, you can change your plan right now. So if for some reason your plan is not living up to your expectations, you have a few more days. So up until March 31st, so January, February, March is called the open enrollment period. So, and this live Q&A is sponsored by Medicare. So you can reach Chapter Medicare. You can reach out to them and you can review your Medicare Advantage plan up until March 31st and to see if it's the best one for you for the rest of the year. See if there's anything else out there that can give you some, extra benefits or save you some more money. And this is also the time you can switch out of a Medicare Advantage and go to original Medicare and get a Medicare supplement. But you'll probably have to go through health underwriting if that's the case. But yeah, you can reach out to Chapter, 100% free. They work throughout the country and they've got great after service. So if you ever need any issues in the future, you reach out to them and they help you out. I stopped by my regional Social Security office today to ask a question. The lobby was jam-packed with people waiting to visit with a Social Security representative. I turned and walked out the door. Yeah. And I was watching the executive. They just started posting these executive meetings online, which I think is a great idea. I was watching one of them today, and one of the guys got up and says, "We don't turn anybody away from the office." I'm like, a person has never visited an office. I never turn anybody away in my office when I worked because that was before, the pandemic and everything. We had kind of some staff, but yeah, if you put your little pinky and little toe inside the door at 3:00, 59 minutes and 59 seconds, just before 4:00, then we helped you at that time. Some other offices throughout the country said, no, we don't have people today to help you out. So can you come back tomorrow? But yeah, we never did that. But those were the old days. Everything is different now. Do not go on Advantage program. It benefits them, not you. If you can avoid it, I agree. Always, always, always check out a Medicare supplement plan, Plan N or Plan G. And then if it's not right for you, as Deborah knows, or Brenda, yeah, as you know, sometimes people just don't have the budget, the monthly budget for the premium. So, or they can't get it because of health underwriting. So a Medicare Advantage is infinitely better than just having Medicare alone, just A and B alone, because there's so many gaps there. If all you have is A and B, then yeah, unless you got a few $100,000 and chock full of nuts can in the backyard, then yeah, you're going to be in a world of hurt if something happens. So Medicare supplement plan, if it's not for you, then just get the best Medicare Advantage plan you can. And then it takes a little bit more work on a Medicare Advantage plan. But Dr. Oz, the new head of CMS, that's if he's a confirmed, then he is a big, big fan of Medicare Advantage. So I'm going to keep an eye on that and keep you all up to date. So the news is wrong. Dr. Ed, did you see the news that said all beneficiaries in April will need to go in person ID to continue to receive benefits? No, it's only for new claims. So as of right now, If you're filing a brand new claim for retirement, Medicare, disability, or whatever, you can't do it online, then you can do it over the phone. But in order to get that claim adjudicated, processed, you have to go down and prove your ID. If you want to change your direct deposit, then you have to do it online or go down. But other than that, yeah. Could you imagine that if they did something that dumb and said all 73 million Americans have to go down the Social Security Administration on April 1st? If you don't, then we're going to stop your benefits for May. Could you imagine that? But Chubba Games, the name, yeah. But I think it's going to be chaos. I think a lot of people think that. And wow. I mean, yeah, if they really wanted to destroy the agency, that's definitely how they would do it. They wouldn't correct that information. I don't see them correct. I mean, they need to do a better job of going out there and telling people, you don't need to, not everybody needs to come down here. So I bet you a bunch of people that don't watch this channel and watch all that social media garbage out there that, yeah, that's going to be unfortunate April 1st. And all of that hurts everybody else. So for the month of April, people are going to go down there because they're going to get all this misinformation that think they have to go down there. And they're wasting their time. Plus they're hurting other people. So those other people that actually need to go to an office to file for disability, or they just lost a spouse, or need to file for retirement or get their Medicare started, those people are going to get hurt because they're not going to get their benefits in time. They're going to lose their health insurance, lose a month or 2 months of benefits, and so not be able to pay the rent. It's going to be a nightmare. So can an adult disabled child who receives survivor benefits in Medicare but who does not qualify for Medicaid get a Medicare supplement plan? Depends on your state, but if the person is under 65, probably not. No. The reason that's a state issue. Most states don't make the insurance companies provide a Medicare supplement plan to people under 65 on Medicare. Once you hit 65, yes, absolutely. That person can. If that person is 65, they no longer have health underwriting. They no longer have to pay 2 or 3 times what everybody else pays for a Medicare supplement. But probably in your state, probably not. But you can reach out to Chapter and they can check. And at the very least, check if they have a Medicare Advantage, see if they're in the best one. And then if they're getting close to 65, then they can help you find a Medicare supplement. So I'm going online tomorrow just to make sure I can access my account. Yes, Global Adventure. Yes, please, everybody do that. Go online. And that way, if there's any issues in the future, you can do it, because Social Security is pretty much requiring, pushing, however you want to put it, people to go online, 100% online. And which I think is, people that can, okay. But the problem is there's a lot of people that can't go online. If there's no service, then they're going to not get the right check at the right time and be in a world of hurt. And there's a lot of people, when you just do it online, people don't know what they're filing for. They don't know that they should file for this instead of this, or that instead of, they should file for survivor benefits instead of retirement, or they should file for retirement instead of survivor. They should file for, Medicare Part A and not Part B. They should file for independently entitled divorced spouse benefits, So if people just go online, they just file for what they think they need, and then they lose benefits. And so there really needs to be someone there to help you navigate it. And so that's why I do this crazy channel, is to help. I turned Luigi. Oh, okay. I turned 70 in April and applied for benefits online. I stopped working in December and have no income now, but still have to pay over $750 a month for Medicare. Can I apply for reduction? Yes, you can. So the $750, that's the IRMA, the income related monthly adjustment amount, the extra Part B premium, and a Part D, the prescription drug premium, you're going to pay high as well. That's based on your earnings from 2 years ago. But since you have stopped working, you can apply for, it's called an SSA 44, SSA 44. It's a life-changing event. So you just fill it out and said, I stopped working, so I don't have to pay the extra premium anymore. So yes, the extra premium. You'll still have to pay the $185 like everybody else, but you won't get charged all the other. So SSA 44, submit it. Unfortunately, like everything nowadays is going to take forever. But if they approve that life-changing event appeal next month or 2 months ago, and you've been paying that since January, they'll give you all that money back effective January. So it'll take you forever, but you will get that money back. All right. This is my second live for the day, and I just wanted to do 30 minutes to kind of just point out that information. Let me do like one or two more questions, and then I'll call it a day. I went online and SSI, you mean SSA probably, says that I have not paid November and December taxes. I have never paid taxes before for my retirement. Yeah, I'm not sure what, yeah, Social Security doesn't care about taxes. That's no relevant to your taxes. Not paid taxes. Ooh, I'm not sure where that comes from. I know Doge just reinstated the the Treasury offset thing. So if you didn't pay taxes, then I mean taxes to the IRS. I don't think it has taken effect this quickly, but yeah, the IRS can garnish your Social Security wages. So yeah, I'm not sure. Other than that, I can't understand why it would say something like that. You're going to have to reach out and yeah, that doesn't make sense. I'm not sure what kind of taxes you're talking about. So because Social Security, doesn't really deal with the IRS taxes in the way you're thinking. All right, this will be the last one. I am 63. I have earned enough credits. Can I file for early retirement and still work? What identifying documents are needed to file for Social Security? Okay, good question. Yeah. So yeah, your early retirement. So you're no longer working, so you've got enough credits. So if you can do it all online, go on to ssa.gov, set up a My Social Security account, file online. Number one, check your earnings record, make sure it's all good. That's how they determine how much your money you're going to get for the rest of your life. And then if you were born in the United States and your name and your date of birth and everything is correct, then you don't even need your birth certificate. So yours should be really, really easy. You just push the button and someone on the other side will look at it eventually. And yeah, you'll get if you start it this month in March, you'll be entitled for March, and then you'll get your first check in April. So pretty easy in your particular case, but make sure, if you have anybody that was entitled to benefits on your record, a current spouse, or, did you stop working because of a disability? You might want to consider filing for disability at the same time. So yeah, there's a lot of other questions that's involved in that. All right, that'll be it. I'm sorry I didn't get to so many more questions, but I will be back again tomorrow. I'll do another topic of the day, and then I'll spend a bunch of time answering a whole bunch of other questions. Y'all take care. Have a beautiful night, and please take care of each other.